Removing a male testis, it becomes a very stressful thing what we talk today. Many of our colleagues and friends, we have been under a very stressful situation. Whatever happens in the testis, we are very fearful to attend a doctor because he might advise to remove the testis. We fear about it. So let us learn what all scenarios which will lead to removal of the testis and what all situations are very worse, so that we'll be mentally very clear about it. In this video, we'll discuss about the reasons behind the removal. We'll discuss about the physiology, what happens after the removal of the testis, how we remove the testis. We'll discuss the surgical part, after effects of removal of a single testis or a bilateral testis. It is a very surprise thing which has been awaiting for you throughout this video. The important anatomy of the testis. What exactly happens during the childbirth? The testis is, as we all know, it is an intra-abdominal organ as well as the baby is inside the abdomen. So after during the pregnancy itself, the testis starts moving towards the scrotum. Along with it, it will seek always its blood supply from the abdominal organs, the veins, arteries and the nerves. And along with it, the most important structure, the spermatic cord, which transmits the sperm cells, that is a vas deferens, everything comes along with it and then it stays inside the scrotum. So the exact mechanism for staying inside the scrotum is, God has created it outside because the temperature compared to the intra-abdominal organ will be always low, so that a lot of good sperms will be synthesized. So, doctor, how the testis exactly is being removed? There are exactly two methods of removal. One is the simple orchidectomy. As the name implies, orchid means it is testis, ectomy means it is removal. So, the simple terms, the testis removal, after a small spinal or a general anesthesia, a small incision will be made in the scrotum and the testis will be removed. So, this is for the simple testicular removal. The second important thing is the high inguinal orchidectomy. It is mainly meant for scenarios like testicular cancers. The cancer cells always spread from the testis along the seminal vesicles and the blood vessels to the upper abdominal organs. So, to minimize the spread, we always make an incision in the lower abdomen, and then from the origin where exactly the nerves and other things originates, we remove along with it. It is called the high inguinal orchidectomy. So what will be the reasons for removal of all these structures? Reason number 5, the most important thing, it is the testicular torsion. So during the anatomical descent of the testis, there is something called gubernaculum testis. It always fixes the testis in the scrotum. So once the fixation is done, it can't move elsewhere. But few scenarios when there is a birth defect, the gubernaculum won't be developed that much, and then the testis will be freely movable. So it is a hanging organ, seminal vesicles, blood vessels and veins. The testis twists on its own, like a neck, it twists around, and the blood supply always gets compromised. So that immediately after the torsion happens, the testis will be devoid of the blood supply. If this scenario proceeds for 2 to 3 hours, eventually the blood supply goes off, the testis will start becoming a gangrenous one. So in that process, we will be able to lose the testis in the same scenario. So what exactly we can do to prevent it? You immediately rush to the hospital within 1 or 2 minutes of the testicular pain, consult your doctor, get a scan done, and then see how the blood supply is. So take the doctor's advice to proceed further. So if this scenario, we always rush to the theatres and then de-twist the testis and revert back the blood supply within few hours. So if you are lucky enough and reach the hospital in a very early manner, we can always preserve the testis. But if it is too late, we may have to lose our testicles. So when it happens, mostly it is a spontaneous one. Many scenarios like we play or we ride a bike or traveling, whatever the times, it happens. So what we usually do is we always go for painkillers and other things, and then we delay the doctor consultation. That should never happen. Always when there is a testicular pain, immediately seek a doctor advice, get a scan done, and then follow their advice. It will be rectified. Number 4 important reason is the cryptorchidism or the undescended testis. So a lot of videos we have been discussing about all these undescended testis. Mainly what happens in the children is when the baby is born, the testis usually descends inside the scrotum. Few scenarios, there may be a delay in the descent. So when there is a delay, the testis will usually lie in the inguinal canals or the intra-abdominal leg. So in that scenario, always it is very important for every parents to always palpate the testis for all your children. If some of the testis is not palpable, always seek a doctor advice, get a scan done, see where exactly the testis is, and then there are so many surgical procedures to bring down the testis which has been undescended and then keep it in the scrotum. But if we are missing it, means it always it will be underdeveloped, namely the sperm cells development won't be there, and a few scenarios it may turn out to be a cancerous lesion in the future date. So cryptorchidism or undescended testis, early identification and early rectification, always we are in safe hands. The third important reason for removal is the testicular cancers. Always all males, like females doing a breast self-examination, always testicular self-examination is a must. We always palpate the testis and see for any hard nodules are around there. And if it is painless, it is even more bothered. And we should always seek a doctor advice, get a scan done. What is the hard nodule? Seek the advice, take a biopsy and prove it. So if it is no problem, leave it. Or if it is a doubtful cancerous lesion, always go in for a testicular surgeries, consulting your doctor. So testicular cancers, the first important thing we have to think in mind is if it is painless, we should be more bothered about it. And always seek a scan done at the earliest. The second important reason for removing the testis, it is the trauma. Whatever happens, all young boys, we play, and during sports injuries like ball hitting, beast riding, the cyclist falling down, bike riders, everywhere there will be a testicular trauma. So in this scenario, there can be a blood clot inside the testis. This blood clot usually expands on itself and then it will create a highly pressurized system inside the testis so that the blood supply also comes down. So here also you should always get a scan. If there is a infection or hematoma, always try to seek advice to remove it so that your pain gets relieved. Always don't depend on it will clear on its own. Don't take medicines on your own. Don't take painkillers on your own. So if there is a testicular injury, immediately seek a doctor advice. The first and the very fascinating and surprising thing for testicular removal reason is our gender transformations. So many people who are born as males, they will be always longing to have a feminine body. Always we respect those their personal feelings. So in that scenario, both the testicles will be surgically removed, and the testosterone hormone which has been synthesized by the testis will be shut down so that all the masculine structures, habits will be gone, and they will slowly start having the feminine look. So this scenario is the very surprising and psychologically very appealing for most of our colleagues. So happy to share all these 5 things. So what exactly happens after we lose a testis? That is the most stressful question we all have in mind. So losing a single testis, 2 things can happen. Our testosterone of that testis will be low, and the sperm cells of that testis will be low. And lucky thing, we always have a 2 testis. So the opposite testis does all the job, synthesizing a good amount of testosterone and synthesizing a good amount of sperm cells to have a very active sexual life and a very successful parenthood as well. So don't worry about losing a testis. And one more happy news is we have a lot of silicone implants which exactly mimics the same scenario of a normal testis. The size, texture and the consistency, everything will be matching the opposite side. So that during removal, we can always request our surgeon to have a testicular implant placed, and then we can have a psychologically very happy life so that nobody can identify whether it is a normal testis or the implanted one. It will be looking like a normal one, and of course the psychological, the social stigma also, it won't be affected. So always keep in mind, during testicular removal, have a testicular implant done. And the very final fascinating thing which we are going to discuss about, what if we are going to lose both the testes? We always bother about having a children and our progeny. There comes the importance of the cryopreservation. There is a facilities for donating our, taking out all the sperms by masturbating or intercourse and preserving all the sperms for the future having a parenthood life. Whenever going in for a testicular removal, always discuss with your doctor to have a sperm freezing for whatever reason it is. Even if it is a unilateral removal also, we can always request the doctor to have our sperms frozen. And then after removal also, if we can check whether the other testicles is working normally or not. And at the later date, we can go for the destroying of the cryopreserve. So always take an option of cryopreservation before the testicular removal. I'm very happy to share all this fascinating information about the testicular removal. Meet you once again in a very wonderful video again. Thank you.